I'm going to introduce, thank you everybody, and happy Mother's Day. I know we all mother something, so that's a good thing. I have plants that I mother, and certainly my clients and friends, and all kinds of people in my life that I do mother. So I'm glad for those. I called my mom this morning. I was so glad I could hear her sweet voice this morning. And she reminded me that I'm going to get to plant daylilies for her because I sent her a photograph of my daylilies on my wall that I planted for a friend. She reminded me how much she loves daylilies. So I'll do that this year. Lori Fiester and I met. She is has many designations, and she is with the Council on Recovery. And Lori and I met, and she has a fun sense of humor. I've just enjoyed getting to know her. Reverend Michael and I had got the opportunity to have lunch with her on the day that Houston flooded. I don't know if you remember the day that Houston flooded, the freeway flooded, and Lori and Mel Taylor we had a great conversation. And Lori is one of those people that is resilient. She went to University of Texas at El Paso. Her graduate degree is from University of Houston. And she's focused on helping families and those struggling with addiction. And she is currently the clinical director of the Center for Recovering Families at the Council on Recovery and the operations. And she's certified interventionalist and certified Daring Way facilitator, and is a registered active tox specialist. And I've had the fortune to get to know Lori, and I've been so fortunate. She's added so much to my life. And certainly I had a major challenge, and she was right there for me and helped me find resources for a friend. So I'm so grateful that Lori is willing to come and talk to us today. So Lori, you start the conversation.
Thank you. Thank you for that generosity there. Basically, I'm just a chick in this whole field of addictions and trying to help folks get well. As Jackie said, I do work for the Council on Recovery. It is a nonprofit. We've been around 70 plus years. My goal is to help people get where they need to go. And so that's one of the reasons why I'm here today, to tell you a little bit about our services. One of the, it's a great gift to be able to choose the work you want to be in. I got into this work because my family was very troubled, in the sense had addiction in there. My dad was an alcoholic. And so I learned very early on how to be a social worker. And it has profited me in that sense, because now I can turn that into, helping folks. But part of what we do is, one of our kind of main themes is we are a great place to start. If anybody ever needs any resources for people who are struggling with mental health issues, from anxiety to depression to substance use or addiction, and even compulsive behaviors, we can be a place to start and treat. Jackie mentioned the Center for Recovering Families, and that's just what it is. It's a place to come for your entire family. We treat children, adolescents, adults. We have outpatient programs that deal with just substance, but we also do groups for parents that may need help with their adolescents. We do parent coaching that maybe you have trouble with your kids. You may even have trouble with your adult children with either their substance issues or their mental health problems, but we're here to kind of help. I have wonderfully talented staff that are all master level and come with a whole line of those letters behind their names too, that which is just such a kind of a miracle in this day and age, to have a nonprofit that takes insurance, can provide sliding scale and get that kind of treatment. which I'm really quite proud of. We don't turn anyone away, in the sense that if I can't help them in my program, then I'm going to get them to another part of the council that has subsidies from the government, either federal or state or county, to get them where they need to go. And because we've been around for so long, we have lots of partnerships. So if we can't help somebody, I will make a referral to a vetted partner. There's a lot of people in the business, so we got to make sure that we're sending our loved ones to the very best. So from there, we do individual counseling, couples, families, or group therapy, as said. And that's the treatment side. But we also have other parts of the council that do serve like mothers and children, mothers and babies that have been affected by substance. We're in most schools with intervention and prevention programs. And we are in high schools too with a program called Choices that help kids begin to learn what the substance stuff is all about and make better choices. I know I think it was Patty talked about suicide earlier, and we're even, when we're seeing this pandemic, we're seeing not only alcohol and drug sales rise, but we're also seeing treatment centers being influxed because people are using, and we're seeing more suicide. So part of this is a piece that we are very concerned about when we're in this kind of isolated time. It's easier to use drugs and easier to be depressed. I would say, not clinically, but most folks have some depression going on because we have lost some part of our world. Whether it's coming back or not, we won't know. And that unknown causes our system to depress. And it's only natural. Most of our reactions, and I'm kind of segueing a little bit, most of our reactions to this time is really normal for an abnormal time. So part of getting that message out is I really appreciate that you have a format here that you all still can connect in your community, because it is vital now, and it will be vital still coming out as the state relaxes itself. And so it's still important to be careful and maintain the community that you have. So I've said a lot. I would love for if you have any questions. And Jackie, if I missed something, please let me know, because it's a Sunday morning brain.
Lori, this is Rose. Are there group settings for, especially at this time, for people that need support and might be hesitant to go one-on-one with a counselor, that there are other ways to help the community?
Well, absolutely. When we think about support, a little different than therapy. There is group therapy going on at the council, and most treatment facilities are using this type of platform like Zoom. While we can't, it's real difficult doing therapy this way in a group, we still are doing it, and we're doing our very best. Now, when we have a 12-step group such as Alcoholics Anonymous, Adult Children of Alcoholics, Al-Anon, Codependency Anonymous, there's all kinds of support groups out there. And there are groups for mental health issues as well. The good news is everyone's using this platform too. In fact, most of our clients are probably doing, 1 and 2 meetings a day because they can now, and there's no excuse. You can get there very quickly as long as you have internet, of course, and or calling in, which is also really helpful. So yes, the answer is yes. If it's alcohol and drugs, what I would suggest to do is just looking up on the internet. Support groups, Alcoholics Anonymous, Houston, and there will be the list of everything that's available. If it's other subjects as well, again, the internet will bring you right to where you need to go. Does everybody understand what addiction is? That's something too that, this is a field that, while we've had addiction since forever, we really don't have a whole lot of information, and there's still quite a big stigma around what that is. I can do a very quick description if anybody has interest.
That would be helpful, Lori. Thank you.
Okay.
Yes.
It is a continuum. So we know that if you think about, we all start with use. And I'm going to use alcohol because that's really the primary. When I think about my center and what we do, while there's many drugs out there, alcohol is still number one that we're treating. And so when you think about a drink, and that's all you think of, that's it. It's just a drink. That's what we call use. I'm not having 2 and 3, and I'm not having any obsession thoughts about it. It's a drink. It's kind of like when I eat lima beans, you know, I just eat lima beans. I'm not thinking about anything, you know, I don't much care about them the rest of the year. It's just when they're there, and that's use. The next continuum part is misuse. And most people who have drank probably have done this once or twice, especially if you're young, is that maybe you're somewhere with friends and you're having a margarita and it tastes good and we're celebrating, and then you have 2, and then we're still having fun, so maybe you have 3. And then you notice when you get in the car that you're intoxicated, and maybe you drive home anyways, and you just notice that was scary, and the next morning you wake up, you yell at the significant other, and you go, oh, I'm irritable. And you remember, oh, I should have stopped at that 1 drink. The 3 really doesn't make me feel good. And we remember that. Now, maybe your misuse might have been a little bit more elaborate than that. I remember mine, and it wasn't 3, it was a lot, and I was really intoxicated. And I remember that very well. Still at 58, I can remember that at 16, from 16. And we never do that again. We go, oh yeah, 1 or 2 is my limit. Now the next piece is when we begin to train the brain. And so it's called abuse. And abuse is when I continue to do the misuse despite the consequences. So I say I'm never going to have that margarita again more than 1 or 2, and I do. The next week we're at the same kind of deal. I'm having just as good a time, and I'm remembering, oh yeah, this is fun. But I don't remember how it made me feel the next day and the risk I took by getting in the car. And I do it again, and I do it again, despite the consequences, despite what's happening. And what we're doing now is forming a pathway of neurons in our brain to remember, oh, remember that feeling? That was so good. And I'm chasing that feeling now. But I have to drink more and more to feel what I did initially, that first night I drank and how fun it was. So I'm building receptors to receive that information in my brain. The neurons are talking. It started like a green pathway, you know, in the grass when you start to wear that down, and then it gets to sand. Well, by now, let's say it's been 6 months, a year, now it's I-10. Now I've got that pathway. And now instead of 3 to get me feeling that fuzzy feeling, now I need 6 and 7. And as I continue that, maybe the consequences are greater. Maybe I've called in for work and I'm feeling, or the significant other is complaining about my alcohol use. Or maybe I'm taking another risk by drinking and driving. Well, at one point, continuing to do that, my body then gets used to that part. And if I stop suddenly, or maybe I haven't continued that behavior for the next day, maybe I've been drinking daily and Monday I decide I'm not going to drink. Well, then my body starts to tell me I better drink by giving me the shakes or a headache or irritability or insomnia or the sweats on it, you name it. Or maybe I have one of those nights when I just don't remember. I don't remember anything. I just remember started drinking and I don't remember what happened, but they told me I was dancing on the tables. Now we know we've crossed this threshold where we've become addicted. And so in between all of that, from abuse to addiction, there are many times where we can stop. Once we get to that physicality, though, we need help. And when we get to that addiction part, our brain, it's like, I don't know if you all look old enough to remember Little Shop of Horrors and how that man-eating plant was going to eat his person that was going to eat him. Well, that's kind of what the brain does. Feed me, Seymour. It's going to feed, it wants to feed despite what's going on. So that's what we call denial. We can't see reality anymore. We're just seeing what the brain wants us to see. And that's that feeling at the end, which still doesn't happen despite how much I drink. So part of when folks get to that abuse level, that's when they're usually stopping to see me. That's when usually somebody's complaining or something's happened, someone wants to intervene. If they're coming at that addiction part where their body is shaking and they're having detox symptoms, and most of the time I'm going to have to refer them to a detox center, because now they've gotten into a medical issue where they could die if they suddenly stop. So we have to ensure that they're safe by hospitalizing them in a detox center or something like that, residential. So that's kind of the progression. Any time in between from abuse to addiction, there's help. And they don't have to hit a severe bottom. It is true that they have to have some motivation to stop, to want to use. And most of the time we can find it, we can help them. How's that? Is that helpful, Lisa? Good.
I have a question. How do you broach the subject if you see a friend that you think is in trouble? Mm-hmm. How do you do that in a way that is caring but not telling them or overstepping bounds? Sure. What's your approach to that?
Well, I appreciate that question, because oftentimes we don't talk about it. Just something like suicide is, we just get too fearful of saying anything. But it is really important how you say it. Because we don't want to elicit the defense mechanisms, because once people get defended, it's going to be a real tough challenge. So I use the Oreo concept, and that's that little cookie on the outside, soft in the middle, and then we got the cookie on the outside. So the cookie is to begin with, is whoever this is, my friend. Oh, I just really care about you so much, and I've been thinking about the times when we used to go running in the morning, and I've seen lately that you haven't been available for that, and I believe it's because of your drinking. And I'm so worried about you. I so want to help you. And if you'd receive it, I have some information for you. Here's the Counsel in Recovery. I mean, it's 5 minutes tops. It's not an on and on deal. It's, I love you, I care about you. Here's the data, and here's the information. We don't ever want to just leave them. Here's the information. I mean, here's the data, but I have no place for you to go. Because I guarantee you, no one wakes up in the morning going, I'd like to be an alcoholic today. This is, it's a great living. They didn't want to be there. It's a suffering position. I guarantee you, by the time anybody has the ism per se, they are suffering and they're in pain, physical and emotional pain.
This is Walter. I've got a question for you.
Hi, Walter.
How do people pay for your services?
Well, we take cash. We also take insurance. There's a sliding scale. On another part of our building, if someone has nothing, then we'll refer them over to state-funded care. This is where then the state will has organizations where they pay them. But often we will really try to assist anybody that walks in. So for instance, while I'm kind of like the top person in the sense of you'll pay most for me, there are other people that don't have all the credentials that they can see for very little money. So like interns or fellows or students that are on their way. So we will help anybody to get there. And of course, then we do slide that. Even folks that can only pay $20, sometimes we'll pay $5. Now, I'll tell you that we don't do a zero often, because when someone doesn't have the buck invested, they often don't do the work. So we have found that over the years. The center has been around since '85, and we have gifted many things, and we notice that when there's a complete scholarship, it's usually a failure.
And I wanted to ask, how often do the families themselves are they involved with your center as well as the person? Are you going to the families' homes and things like that too?
So other parts of the council do home visits. What we, especially some of the ones that are federally funded, the center does not. Our family program meets once a week for our intensive outpatient program, but we have other family options as well. So like I do a lot of family therapy. And so it's really about where the family's at and what they're going through and what they're willing to work on. So it could be once a week, it could be twice a week. It just depends upon what they're doing. I work with families for most of my life, and that's actually some of the best work to do because it's the system. Family is a system. And when we've got all the playing party in the room, it's just almost a miracle to get the work done. So even and actually right now Zoom has been really helpful because we can get families that are spread out now, which we couldn't before. So that has been a gift to our family program. A lot of times when we do, Jackie did say we do interventions, and we do. I'm a trained interventionist. We do an invitational intervention called Arise, where it's not the surprise thing that you see on TV. It is one that is a very respectful, loving conversation. And that's where families mostly come in. Oftentimes I can spare the family going through an intervention by doing family therapy because the interventions are quite hard on the system itself. So if we can get in there and work with the family before that, then that's the gift. Did that answer your question, Karen? Okay. Oh, well, let me also say we even have a group, a therapy group for family members that are still dealing with a loved one that has an addiction or a compulsion. So they have their own therapy group too, and it's a wonderful group. Please feel free to holler at us anytime. I'm sorry I don't have anything to put up on a slide to show you all. But the center's line is, let's see if I can remember it, 713-914-0556. Feel free to contact me anytime if you have any questions or thoughts about your family if you need.
Tell us just how do you handle all this? This must be a real intense time for you.
Well, you know, it's so interesting. Being a therapist and a social worker, I've really had to learn self-care. And throughout my life, different things have happened. Hurricane Harvey put me on my butt. And this was, you know, one of those times when the therapist really had to seek lots of help. And, you know, since then, and now we've got COVID, I have to work a lot harder than I used to just to keep the head going and being able to hear and be present to people. And that's the hardest part is, you know, that ear and listening, that listening tool takes a lot of work. And so I think today that's the piece is I have to rely on my exercise, my prayer, my puppies, those poor dogs, those things that bring life to me more so than ever. And it's a challenge every day when, you know, you just look at TV and something's happening somewhere. So, and in my staff, I see how hard it's been. Most of my staff are 20s and 30s, and they've never experienced anything like this. So I'm kind of that mom too, in that sense of helping them stay present and take really good care and not pushing too much. Despite, you know, the needs of the clients, we have to, if we're not here, we can't help. So yeah, that's the deal is I have to do my meetings, my prayer, my stuff to take care more so than ever. And I think I'm going on 32 years in this business. So that's why all that gray is there.
Thank you, Lori. It has been an experience and just a joy to get to know you. So grateful. My life has been so much better from Al-Anon meetings. So certainly am grateful for the work you do.
Thank you,
Bye.
Jackie.